The trial was being conducted by a private laboratory, Rennes, and the patients are all at hospital in the city of Rennes in France. A man is clinically dead and 5 others are in a disturbing condition after testing a new cannabis-based painkiller as part of a clinical trial, it has been reported. The trial was being conducted by Biotrial, a private laboratory. The patients are all at hospital in the city of Rennes in France. The first was taken to hospital on Monday. US newspaper says the other 4 patients' condition is disturbing. France's health ministry did not say what the medicine was intended to be used for, but said the 6 patients had been in good health until taking the oral medication. This test was carried out at a private establishment specialized in carrying out clinical trials, the ministry said. The 6 victims are being treated at the hospital's neurology department. BFM TV said 8 people took part in the trial, 2 of whom took the placebo. All of them are aged between 30 and 50. Read more. Ovarian cancer deaths could drop by 20% with annual blood test, experts say. Have you ever taken part in a drugs trial? Share your experiences using the form below or email yourmirror@mirror.co.uk. All trials on the drug at the clinic in Rennes and Brittany have now been suspended, and the government agency responsible for drug safety and the Central Office on the Fight Against Threats to Environmental and Public Health of the National Gendarmerie of France are investigating. US Dalos reported that Biotrial led a clinical trial on behalf of the Portuguese pharmaceutical company Bio, the leading Portuguese pharmaceutical group. Everyone else in the trial has been contacted by the lab, which is a short distance from a medical center, and called in for tests. It is a phase I test, where a small number of people, who may be healthy or have a medical condition, are given a small dose of the drug under medical supervision to check for any side effects. Minister of Social Affairs and Health Marisol Touraine is on her way to Rennes and will give a press conference this afternoon. Biotrial's turnover was €35 million in 2014. It is also present in the US and the UK. They continually recruit for volunteers and recruit people aged 1880, and they are paid between €100 to €1,500. Not all trials are residential. Biotrial employs 300 employees worldwide, including 200 in France. It undertakes trials on behalf of pharmaceutical companies. Biotrial's UK and French headquarters have been contacted for comment. A statement on their website about patient safety reads, "Clinical trials are heavily regulated, and the safety of patients is at the heart of each test. Studies suggest cannabis can be used to reduce nausea and vomiting during chemotherapy, to improve appetite in people with HIV/AIDS, and to treat chronic pain and muscle spasms." Shocking figures released in June revealed that thousands of Brits have been left seriously ill or disabled after suffering adverse reactions when they agreed to test new medicines in clinical trials. Data released by the UK watchdog under Freedom of Information legislation shows 7,187 people suffered such reactions in the last 5 years. Of these, 493 reactions were immediately life-threatening and 197 resulted in significant disability or incapacity, according to the Medicines and Healthcare Products Regulatory Agency. The figures come almost a decade after a trial in which 6 healthy young men suffered devastating reactions, leaving them in intensive care. The men were each paid £2,000 to take part in the trials at Norfolk Park Hospital in London, but, within minutes of being injected, their heads had swollen like balloons. Between 90,000 to 95,000 Brits take part in such trials each year. Data released to the Mirror did not indicate how many of the victims had been paid to take part. Dr. Ben Wally, professor of neuropharmacology, University of Reading, and member of the British Pharmacological Society, said, "Safeguards for clinical trials are well established and standardized regulation is in place, which specifies how clinical trials should be conducted. These are largely the same across Europe and the UK. However, like any safeguard, these minimize risk rather than abolish it. There is an inherent risk in exposing people to any new compound. Hundreds of clinical trials involving thousands of people are underway at any time. It is very common for there to be side effects since all medicines, approved or in testing, exert both the desired effect and unwanted effects. For the most part, side effects are limited and tolerable, although, for some medicines, They determine the upper limit for a dose that can be used. The doses are most often given to the patients in a staggered fashion in order to minimize the risk of all volunteers experiencing a serious adverse effect. It is therefore unusual for reports to mention that up to 6 people have been affected unless the adverse event has taken several days to appear.